Welcome back, everybody, to American Safety Programs and Training, Cranston West. Chapter review for Chapter 21, Toxicology. So, what we're going to break this chapter down a little bit into some categories, review each category in detail, and then we'll do a chapter review. So, we're going to discuss what is toxicology. We're going to talk about some definitions that we need to understand first. You need to know and understand what these definitions mean, so as we go throughout the chapter and discuss the multiple subjects and the things we're going to talk about, you have an understanding. We're going to talk about using our common sense, using our index of suspicion, using our situational awareness to make sure that we don't become a patient from a poison where the patient has been poisoned. Is it airborne? Is it powder? Is it liquid? What is it? Where is it? Where did it come from? How'd they get it? Okay, we want to make sure that we don't get it. We're talking about how does the poison get into the body? What are the 4 routes that a poison uses to get into our body, to affect us? What do we do on scene? How do we do a patient assessment? How do we treat a patient? What do we do? We're going to discuss that in a little bit of detail as well. Then we're going to discuss some specific poisons that are common out there. Some are more common than others. Some are from the 70s and 80s. But they're still common. They're still out there, and they'll always be out there. And then we'll do a review with the 10 questions. Okay? So, let's get started. Toxicology. Where does it go here? Okay, so introduction. Every day we come into contact with things that are potentially poisonous for us. Okay? Potentially poison to us. We don't know if it is, we don't know if it isn't. Every day we come into products. Acute poisoning, which means quick, rapid poisoning, affects about 2 million people each year. And chronic poisoning, which is much more common, is usually a result of chronic or an extended period of time, which is chronic, is usually associated with extensive or long time drug or alcohol abuse. Toxicology. Toxicology is the study of toxic or poisonous substances. Now, some of the definitions. What is a poison? A poison is any substance whose chemical action can damage body structures or impair body function. All the way down to the cellular level, all the way up to and including you being able to stand up straight and walk down the street. Okay? Toxin. What is a toxin? A toxin is a poisonous substance produced by bacteria, animals, and or plants. Okay? A toxin is something, good example would be food poisoning. The food itself being rotten does not make you sick. But as the food deteriorates, as the quality of the food degrades, it creates bacteria, and that bacteria, the creation of bacteria, actually produces toxins. And it's the toxin that makes you sick, that gives you the food poisoning. Okay? Substance abuse. Substance abuse is the misuse of any substance to produce a desired effect. And an overdose is a toxic dose of a drug. So let's go back to substance abuse real quick. Prime example. You break an arm and the doctor prescribes you an opioid. Let's say it's hydrocodone or OxyContin for pain. And he gives you enough medication to last you a week. Well, some people can get addicted to it. Some people don't get addicted to it. Of those people who become addicted to it, can become addicted very quickly within the first couple of doses. Other people will take a couple of days or a couple of weeks. Everybody is different. But substance abuse is if the doctor says he wants you to take 1 pill every 6 hours as needed for pain, and you start taking that one pill or 1 capsule every 6 hours, but after about a week or so, you're like, you know what, I don't feel that much pain. but you like the weird feeling that the medication gives you. So instead of taking just one pill, you knock it up to 1.5 pills, or you knock it up to 2 pills. So you're taking more of the medication. You're taking a stronger dose than what was prescribed, because you want to get that same effect that you were getting when you were taking one pill. Okay? Then all of a sudden, you're taking 2 pills a day, and you're not getting the same effect. So you take a third pill, and you start feeling what you were feeling before. And you're like, okay, I'll just keep taking 3 pills now. So you keep increasing your dose so you can keep obtaining that desired effect from that medication or from that product. That's called substance abuse. When you take too much of that medication, or when you take too much of that item, of that product, you take too much of it, and your body says, whoa, I can't deal with this anymore, I'm going to give up. And it puts you in cardiac arrest, or gives you a heart attack, or gives you respiratory difficulty, gives you altered mental status where you can't think straight. It starts affecting your body's operations. That is an overdose. And an overdose is toxic. Toxic meaning you have too much in the system and it's going to kill you because your body cannot process it. Your body's being overwhelmed by what you're taking. So that is an overdose. Things we do for an overdose, we'll discuss that with some of the medications we give as EMTs. There's 2 medications we give as EMTs. We can give activated charcoal, and we can give naloxone. So, next thing. Identifying the patient and the poison. We're not poison scientists, specialists. We can't remember everything. But just like with the heart attack, just like with cardiac arrest, just like in the chapter that we just ended up discussing, immunologic emergencies, we need to be able to identify, based off of the signs and symptoms, or just off the signs, we need to be able to identify that something's not right with the patient. We got called because somebody felt something was wrong, and they were scared shitless. I mean, they were scared. So they decided to call 911. So we show up, we find the patient, we have to take into account, what are we walking into? What do you see? What do you hear? What do you smell? As you approach the building, is the building a well-kept building, or is it a rundown property? When you walk in, what do you smell? Does it smell clean? Does it smell dirty, disgusting? Do they have trash laying around the floor? Okay, what do you hear? Do you hear people crying? Do you hear people talking about drug use? Okay, what's your overall impression of the situation? What's your overall general impression of the patient once you see the patient? Where are they? Are they lying on the ground? If they're lying on the ground, are they face down? Are they on their back? Are they on their left side, their right side? Are they in the fetal position? Are they sitting up? Are they in a chair? Are they on a couch? Are they on a table? Are they leaning over a counter? Where's the patient? What is the body position of the patient? And when you first look at the patient, what does their skin look like? You can't tell temperature and condition, but what does it look like? Do you see any cyanosis around the mouth? Do you see any nasal flaring signifying that the patient is breathing? What does the skin color look like? If they're a person of African American heritage, does their skin look the color that it should, or does it look pale? If you see a Caucasian individual, okay, does their skin look a lot whiter than it should? Does something just doesn't seem right with the way that they're being presented to you? So we have to try to identify the patient and the poison. We have to try to identify what patient the patient took, what type of poison they were exposed to. Was it a powder, a liquid? Was it airborne? And this is something we have to do fairly quickly too. But based off of the information that we get from the dispatcher, based off of the information as we're approaching the building, once we enter the building, and if anybody wants to give us any information about the patient before we see the patient, we're slowly building up our impression as to what we're walking into. And again, scene safety. If at any point in time you feel the scene is not safe, you are to leave that scene immediately, drop your equipment, get out of there, or take your equipment with you if you can, and wait for police to arrive on scene to secure the situation. You never know what you're walking into, especially when it comes to poisons, because you don't know what type of poison it is. Could it be an overdose from an illegal drug? Could it be a poison because someone has alcohol poisoning because they're drunk as can be? Is there somebody else in the room that could be there to hurt you? You never know. Okay? So, you have to be familiar with what the different types of poisons are. Are they opioids, opiates? Are they methamphetamines, simple pathomimetics? Are they sedatives? A lot of different ones out there. And we'll talk about them individually because each one gives different types of, treats the body in different ways. All of them will give you an irregular heartbeat. It'll give you an arrhythmia. All of them will affect your breathing. All of them will affect your pulse. All of them will affect your central nervous system. And in doing so, your body's not in homeostasis and your body's fighting to try to stay alive. So, identifying the poison of the patient. If possible, when you're talking to the patient, in addition to doing your sample and your OPQRST, you want to find out as quick as you can, what did you take? When did you take it? Or when did you become exposed to it if it's something that they were exposed to? How much did you take? How did you take it? Did you inject it? Did you drink it? Did you smell it? Or if they're exposed to it, was it liquid or a powder and was absorbed through their skin? That sounds more like it's probably going to be like an industrial accident. Did you have anything to eat or drink before you ingested the medication? Before you injected yourself with it, or before you drank it, or before you swallowed it? The reason why you want to know if the patient had anything to eat, or if they ate anything prior to taking the poison, is because if there's food or if there's product in the patient's stomach, it'll slow down the absorption of the poison into the body, and it might give you some extra time to start treating the patient before the body fully starts to absorb the poisons in the intestinal tract. Does the patient have an antidote, and have they taken it, or has somebody given them the antidote for the poison that they took? And you want to know how much they weigh. The reason why you want to know how much they weigh is because some medications that we can give to a patient, whether it's a poison or anaphylactic reaction, or whether they're a pulmonary emergency or cardiogenic emergency, the amount of medication that we give a patient is usually based off of their weight. There's a lot of formulas that people use, but the simplest formula I can teach you would be is you need to determine or estimate a person's kilograms. Now, if somebody's on scene, they can tell you exactly what the patient weighs to give you a great idea, or they can give you a ballpark idea. That's great. If nobody is there, then it becomes a guessing game. You have to just do your best. Okay? If you're wrong, you're wrong, but do your best. You're probably going to be in the ballpark. You have to estimate what the patient's weight is. Now, let's just say there's somebody there who tells you that the patient, John Smith weighs 200 pounds. So what you do, you come up with the actual weight, or you come up with the estimated weight of the patient. In this case, it's John Smith. You're being told John Smith weighs 200 pounds. You take the weight and you cut it in half. So what's half of 200? It would be 100. Then, once you take the weight, you cut it in half. Then you take that number and you take 10% off of it. The remaining number is the person's weight in kilograms. So, somebody weighs 200 pounds, cut it in half. That knocks them down to 100 pounds. Take 10% off of 100 pounds. What's 10% of 100 pounds? It's 10. So take 10 out of 100. That leaves you 90. Okay? Their estimated weight in kilograms is 90 kilograms. Okay? I'm going to use even numbers here. So say someone weighs 400 pounds. Say you have a bariatric patient. They weigh 400 pounds, cut their weight in half. That's 200. Take 10% off, that's 20. What's 20 minus 200? 180. So their weight in kilograms is approximately 180 kilograms. Okay? So that's why it's important to determine the patient's weight. Try to determine the nature of the poison. Look around the immediate area for clues. Are there a lot of liquor bottles? Are there used syringes around the area? Could it be that the person took an overdose of a prescribed medication, such as oxycodone, hydrocodone, Percocet, OxyContin, or some other medication? Take a look at the medication bottles. There should be a date that was filled and a quantity that was put into it. If Mr. Smith was prescribed Percocet and he was prescribed 60 tablets and was filled 5 days ago and he's supposed to take 2 tablets a day, that means that there should be 40 pills left. But if there's only 4 pills left, what happened to the other 38? Or what happened to the other 36? Okay? So you needed it. That's the way you can try to figure it out. Are there any spoons around that somebody might have been, taking crack? Because you can either sniff, you can either melt and inject crack, or you can heat it and you can inhale it. Is there a crack pipe somewhere nearby? Okay? So look around the area. Use your common sense. Use your situational awareness. Okay? Be smart. Take any suspicious materials with you. Take a biohazard bag. If you see some things you think are not right that might be a drug, you may not know what it is, but you think it might be a drug, put it in a small biohazard bag, take it with you, give it to the doctors at the ER. They can have it analyzed and help determine what the person took. Are there containers at the scene that provide critical information? Okay? Did they drink lighter fluid? Did they take too many medications? Did they drink Drano? Anything. Okay? Examine, if they vomited, examine to see if there's any pill fragments that didn't dissolve in their vomit. If there are, see if you can take your cell phone, grab a quick picture of it, or pick them up, put them in, scoop up some of the vomit, put it in a biohazard bag, and take that to the hospital. Okay? And make a notation of any. You want to make sure that you note and document anything unusual that you see, hear, and smell. Okay? Your documentation can help save the patient's life. Treatment depends on how the poison got into the patient's body. It depends how it got into them, and it depends what it is. First of all, they have to determine what is it. Then, how did it get into the patient's body? If it was absorbed through the skin because it's a powder, or liquid, or a gel, it would have been more slowly absorbed than if it was injected or if it was inhaled. Okay, if it was ingested, then it's going to you've got about 30 minutes for the poison to start taking effect. Okay, so there are 4 routes that poison get into the human body: inhalation, absorption, ingestion, and injection. Inhalation is when you breathe it in. You breathe it in, it goes down into your lungs, it goes into the alveoli, and it's instantly put into your bloodstream. Just like with injection. Injection, which is the last one, you inject it directly into your muscles, okay, as an IM, or just underneath the skin as an SQ, and it is absorbed immediately into the bloodstream through the muscles and through the tissues. Absorption is got to get through the 3 layers of skin. Okay, so the absorption rate is much slower, but it is still absorbed. However, if you have a small portion of the skin that has a poison on it compared to a larger area, if you have a larger area that has a medicine that has a poison on it, even though the absorption is slow, the body would still be absorbing a great deal of it because it's over a wide area of the skin. And the last one is ingestion. We take in the mouth. So we have inhalation, absorption, ingestion, and injection. Great test question, people. Great test question. Okay. Some of the things that people used to do. Number 1, upper left-hand corner, rubber cement or rubber glue. In the 70s and 80s, rubber cement or model glue was very, very popular. You'd buy a big container of it, and you'd pop it open, and you'd smell it, and it would give you a high. But the way it gave you a high was that it was blocking off the hemoglobin on the red blood cell, where the hemoglobin was not able to allow oxygen to latch onto it. Therefore, you were decreasing the flow of oxygen into the brain, and you were basically starving your brain of oxygen, and that's why you were getting lightheadedness. Okay. Also, there's some chemicals in it as well. The chemicals weren't good for you. Okay. So that's an example of inhalation. Another one would be people would buy spray paint, cans of spray paint. They'd get a paper bag, they'd spray a bunch of paint into the paper bag, and then they would inhale the paint fumes. The chemicals that were made to paint the paint, or the chemicals that were made to create the paint, gave off poisonous fumes, as well as the condensed gas in the can. Again, when the manufacturers created them, they weren't designed to be inhaled. That's why they always say, when you use paint, use a well-ventilated area because the paint fumes are very strong. Well, people would take, the gases from the spray paint can and the fumes from the paint, spray it into a paper bag and inhale it that way. Okay. Bottom left-hand corner, you see a picture of somebody taking pills. They could be overdosing themselves on medication. The one on the right, injection. They're injecting the medication into them. And then the one up right-hand corner is absorption. The guy has a chemical on his skin. Now, if he had a small section of it, absorption wouldn't be that bad. But if he's got a huge section of them like that, that could be a very serious situation, especially during the summertime because it's hot, your body sweats, and your pores are wide open, so the absorption rate would be much quicker. Also, if the poison is over a larger portion of the body, you're going to be absorbing a lot of the poison quickly because it's covering such a wide area. Okay, so let's talk about inhaled poisons. Okay. One quick thing. When you're dealing with a poisoning patient or a suspected overdose, easier said than done, try your best not to judge the patient. We have no idea whether the patient did it deliberately. We have no idea whether the patient did it accidentally. You don't know all the facts. Our goal is to treat the patient and not judge the patient. And it's easier said than done. But just keep that in the forefront of your mind. Okay? We don't walk in these people's shoes. We don't know what they're going through. So be the medical professional that you want to be and that you can be and treat the patient. Okay? So, with that said, inhaled poisons. You want to move the patient to fresh air right away. A lot of times if somebody has an inhaled poison, a lot of the times getting them fresh air out of the environment where the poison is does great things. The patient may require supplemental oxygen. Determine what device you want to use. Do you want to use a nasal cannula? Do you want to use the non-rebreather, or do you want to use a BVM? If you suspect the presence of a toxic gas, get out of there, get the patient out of there, and call for the hazmat team. They can come in with special suits and self-contained breathing apparatuses, otherwise known as the scuba gear, which is what you see firefighters carry all the time. And they can go and they can find out where it is and hopefully they can get it taken care of. Okay. All patients who have inhaled poisons require immediate transportation. Having a little drop of poison on your skin, if it's Drano, is not going to hurt you compared to having that same quantity in a gaseous form and you inhale it into your lungs. The reason why, if it's on your skin, it's being absorbed very slowly. But now take that drop of liquid, turn it into a vapor, and put it into your lungs. It's going to cover a very wide surface of the lungs, so it's going to be inhaled very rapidly. When you have an inhaled poison, there's a very good chance that the poison can do damage to the upper and lower airway, and to the lungs, and to your body's ability to perfuse that oxygen and diffuse that oxygen. So the very, very, very strong possibility you're going to have a respiratory emergency on your hands. Some patients use inhaled poisons to commit suicide in a vehicle. Prime example, Mr. Smith can't take it anymore, locks himself in his car's garage, takes a hose, turns his car on, attaches one end to the exhaust of his car, puts the other end inside his back window of his car, and rolls all his windows up. Okay? Exhaust fumes contain high levels of carbon monoxide. He dies of carbon monoxide poisoning. Okay? Chemicals or detergents in a tightly sealed vehicle create a type of gas chamber. Okay? If you guys remember Buffalo Wild Wings up in Massachusetts about, 6-8 months ago? The manager of a Buffalo Wild Wings died because guys remember this was all over the news. The manager died because they were cleaning the floor and they apparently mixed some chemicals in the mop bucket and it created a poisonous fumes, and everybody was able to get out, but the manager was not, and he died on scene. The reason being is that two of the oldest chemicals, cleaning chemicals that people used to use all the time, ammonia and bleach. Ammonia and bleach are two chemicals that are used to clean, but you can never, ever, ever mix them together. If you mix ammonia and bleach together, then you create a poisonous gas that is very toxic. Apparently what they did was they had multiple floor cleaning chemicals and they mixed one with the other, not knowing that one had bleach, one had bleach, one had ammonia in it, and they mixed them, and it created the poisonous gas. And apparently, the manager, from what I heard, was trying to get it cleaned up, was trying to get it out the back door, and he was in the room too long, and he inhaled too much, and it was a lethal dose. So you might want to consider, that part of the kitchen was a gas chamber. Okay, say if somebody is in a car and that area is filled with poisonous gases, remember when you open the door to that chamber or to that room, that as you open the door, it's going to create a suction, and a lot of those poisonous gases are going to be coming out right at you. So be careful. Contact hazardous materials responders and have them remove the victim. Don't you do it. Absorbed and surface contact poisons can affect the patient in many ways. Skin, mucous membrane, or eye damage, chemical burns, they can have rashes, and they can have systemic effects. Distinguish between contact burns and contact absorption, or you can have a combination of the two. Did the chemical burn the skin? At the same time when it was burning the skin, was a poison absorbed into the skin, or did it just simply burn the skin? Okay, signs and symptoms of an absorbed surface contact poison is a history of exposure, liquid or powder on a patient's skin. They might have burns, they might have itching, irritation, redness of the skin, and odors of the substance. Okay, you might smell something. It smells weird, and it's on their skin, it's on their clothing. They're going to have red, irritation, itching, burning skin. Okay, sort of sounds a little bit like anaphylactic when we were talking about it, right? Okay, but this is not anaphylactic, this is poisoning. Emergency treatment. How do we treat one of those patients? Well, number one, scene safety BSI, avoid contaminating yourself and your partner and other people. Remove the substance as rapidly as possible, and remove all contaminated clothing. If the person's clothed and there's poison all over, a powder or liquid, get the clothing off them. Make them trauma naked if you have to. Okay? If it's a powder that's on the patient, use a dry towel and brush it away from you, and hopefully there's not a wind blowing the poison back at you. Brush it off the skin as best as you possibly can. If dry powder has spilled, brush off and flood with water for 15 to 20 minutes, then wash with soap and water. You're not going to be unseen to wash anybody with soap and water. Okay? Get the powder off the patient. Get a bag of saline if you have to. Use that to rinse the area, dry the area, get the patient transported to the hospital. If a liquid has spilled, flood the area for 20 minutes. Wipe off the liquid off the patient's skin and rinse it for 15 to 20 minutes. If the poison is in the eyes, and it's easier, I can do it easier than explain it to you, but that thing right there at the guy's nose, okay, and it looks like they're actually draining saline liquid into the patient's eye. And what they do is they poke the saline bag and they take a nasal cannula and they connect the nasal cannula to the bag of saline, which is basically salt water. And the part that goes in your nose, that's where the saline starts dripping out. And you want to put the liquid right there towards the center of the nose. So it goes down the side of the nose, into the eye, and it flushes out towards the ear. You don't want to flush a poison from somebody's eye and then that liquid goes into the other eye. Let the liquid go on the outside of the face when you're flushing somebody's eyes. Okay? As for an industrial setting, safety showers and specific protocols may be available. Hazmat team should be available to assist you. Ensure that you, your team, and the patient are thoroughly decontaminated, and obtain material safety data sheets. MSDS sheets, material safety data sheets. Anytime a company, whether it be a restaurant, mom and pop grocery store, whether it is a industrial site, a school, any business that buys anything that contains chemicals in it, whether it's Windex, whether it's Dawn dishwashing soap, whether it's Dial soap, whether it's Ivory, whether it's laundry soap, anything. It has to be accompanied the individual selling the product to the company, the manufacturer, is required to provide a sheet that lists the name of the product. In this case, let's talk about Windex. So the name of the product that they bought was Windex. It has to list the chemical name of every single chemical that was used to create Windex. Everything down to the type of water, the type of chemicals, the names, the chemical names, the science names, and even the color dyes. And everything has to be listed in percentages, how much of what is in this mixture. And on that MSDS sheet, not only does it have the name of the product, but also the name of all the individual chemicals, their quantities, also the treatment as to how you treat exposure to each one of those chemicals. Okay? It is also supposed to have the Poison Control Center's phone number on it. And that poison control number is 1-800-222-1222. That's your national hotline. If anybody poisons themselves and you have no idea what they took, or you know what they took, then you can always call that number of 1-800-222-1222, and that'll put you in contact with a poison specialist. That phone number is manned 24/7, 365, and people from any part of the United States can contact that number. If you know what the poison is, you tell them what it is, how much you think that they took, how long ago it was, and they can tell you exactly what to do to treat the patient. Whether there's something you can do for them right then and there, or you've got 911 already on the way. Okay? So remember that. Material Safety Data Sheets, otherwise called as the MSDS sheet. Ingested poisons. About 80% of poisonings are by mouth, usually accidental in children or deliberate in adults. In the 1960s or 70s, I believe, childhood poisons were much, much higher than they are now, until they came out with the child-proof caps on prescription drug containers or cleaning chemicals now. You guys are used to seeing it. You buy a chemical, you got to push down and turn, or you got to push down, squeeze, and then turn for the cap to become unlocked. 30 years ago, it wasn't like that. Everything was just turn the top and it'll open up. Okay? But now that they've introduced the child safety caps on things, accidental childhood poisons have greatly gone down. But adult poisonings have increased. Okay? Especially the deliberate poisons. Signs and symptoms vary with the type of poison, the age of the patient, and the time that has passed since the ingestion. Okay? How long ago did they take it? How much did they take? Why did they take it? Where did they get it from? How old is the patient? Remember all those questions? Signs and symptoms of ingested poison. Signs and symptoms may include burning around the mouth, gastrointestinal pain because the poison's in their it's in their stomach and it's in their intestines. And poisons are not designed to be in the intestines and the stomach, so therefore it's going to do a lot of damage down there, and they're going to feel the pain. Vomiting, cardiac dysrhythmia, which is basically, as you know, it's an irregular heartbeat, and it might include seizures. Treat signs and symptoms and notify the poison center and medical control immediately. Consider if there is unabsorbed poison in the gastrointestinal tract and whether you can safely prevent this absorption. Okay, and that's what one of the drugs that we can give somebody is called activated charcoal, but we'll talk about that in a little bit. Oh, speak of the devil. Ingested poison. Some EMS systems allow EMTs to administer activated charcoal. It is basically charcoal in a water, mixed with water. And you got to shake it really, really good, and you have the person drink it. And if you take a look at the charcoal, it has very minute cracks in the little... The charcoal has been ground down to such a powder that in order to actually see a piece of charcoal, you got to put it under a microscope. When you look at that piece of charcoal under the microscope, you see hundreds and thousands of cracks all over it. Well, for every crack that this cell or this particle of charcoal has, that increases the charcoal's surface coverage. The more surface coverage that piece of charcoal has, the more absorption that the more absorption power that it has. And what this activated charcoal does with certain poisons is that the activated charcoal will actually have the poison bind to the charcoal and will not allow the poison to be absorbed in the intestinal tract. And the only way to get this comes out is you poop this black stuff out. But the poop stuff, or the black poop, is loaded with poison. So the poison latches onto the charcoal, and it can't be absorbed because the charcoal doesn't let go of it. Injected poisons. Exposure by injection includes intravenous, drug abuse, and envenomation by insects, arachnids, and reptiles. So insect, bee, wasp, hornet, arachnids, spiders. I do not like spiders at all. So the poisonous spiders out there are black widows. You've got the brown recluse, is very popular up here in Rhode Island. And tarantulas in the tropics. And then reptiles, snakes. An injected poison is usually absorbed quickly into the body. It cannot be diluted or removed from the body in the field. All you can really do with this patient is get an IV started, have ALS, they'll get an IV started, and they'll get the patient to the hospital as quickly as they possibly can. Signs and symptoms may include weakness, dizziness, fever, chills, unresponsiveness, and excitability. All depends on what type of poison it was and how much was squeezed into the patient's body. Monitor the patient's airway, make sure that it's secure. If it's not, secure it. Provide high flow O2. Be alert for any nausea and vomiting. Get your suction ready to go. And transport promptly. Remove any rings, watches, and bracelets from around the area of the injection site if swelling occurs. Because sometimes the poison would cause such massive swelling that if the person's still wearing a ring, that ring would act like a tourniquet, and anything beyond the ring or beyond the bracelet would be greatly reduced with blood flow, and they could possibly lose the limb. So getting that stuff out their body as quickly as you possibly can. Scene size up. Take standard precautions and look for clues that indicate a substance or what was the substance that was involved. Is there an odor in the room? Is the scene safe? Are there any medication bottles lying around, like I said earlier? Is there any medication missing to indicate an overdose? If you're supposed to have 40 pills and there's 2 pills left, where'd the other, 38 pills go? Okay? You don't know for a fact, but you strongly suspect that they took them. Okay? Are there any alcoholic beverage containers present? Are there like 3 bottles of bourbon and a bottle of vodka or something like that? Are there syringes or other drug paraphernalia? I already talked about that. Or is there a suspicious odor that may indicate the presence of a drug laboratory? Okay? Best way I can... a meth laboratory, to me, I smelled one before. It smells like burnt pasta. And the best way I can describe that is if you've ever cooked a box of pasta and you left it on the stove too long and almost all the water evaporated and the pasta burned to the bottom of the pan, it smells like that. That's how I remember it. Primary assessment. Determine the severity of the patient's condition. Obtain a general impression. Assess the level of consciousness. Determine any life threats. Do not assume a conscious, alert, and oriented patient is stable. When it comes to a poison, some poisons are absorbed very quickly. Some poisons are absorbed very slowly. A lot of it depends on the patient's metabolism as well. They may be talking to you now, but 10 minutes down the road, they may not be talking to you at all. So, what does it sound like? Obtain a general impression. Assess the level of consciousness. Determine any life threats. What do those sound like? That sounds like your primary assessment. If you go back, scene size up. Scene size up is what? Scene safety, BSI, MOI, NOI, number of patients. Consider C-spine stabilization. Consider additional resources. Do you want the police, extra firefighters? Do you need ALS on scene? Okay. Then you move on to your primary survey. What's your general impression of the patient? Determine level of consciousness. Okay. Airway, breathing, circulation. Is the airway secure? Yes or no? If it is, great. If not, secure it. How do you secure it? OPA, NPA. Breathing. Are they breathing adequately? What's the normal respirations of a healthy adult? Okay. 12 to 20. What if they're breathing too slow or too fast? What do you do? Are you going to give them oxygen? Yes or no? If you want to give them oxygen, how much oxygen? Going to give them a nasal cannula, non-rebreather, or are you going to breathe for them? If you're going to give them oxygen on a nasal cannula, what's the liter flow? What's the liter flow of a non-rebreather? What's the liter flow of a BVM? What's the saturation level? This stuff you guys need to know. Okay? Airway and breathing. Ensure an airway Is open and adequate ventilation? If the patient has difficulty breathing, begin oxygen therapy. Have suction available. Excuse me. Circulation. Do they have a pulse? Is it strong or is it weak? Is it fast or is it slow? You all know what the pulse rate is of a normal healthy adult. So is it too slow or too fast? While you're checking the pulse, what are you touching? You're touching the skin, which is the largest organ on the human body. And when you're checking for the pulse on the radial, what are you going to check? Or what can you tell? Skin color, temperature, and condition. Okay? And if the person's skin is cool and clammy, and they have some type of respiratory difficulty in any way, shape, or form, what does that mean? That means a very strong possibility of what? What's that 5-letter word? Begins with an S, ends with a K. Shock. What do we do with somebody in shock? Put them in a position of comfort, high flow O2, rapid transport to the hospital, and keep them comfort. And position of comfort. Oh, keep them warm. Keep them warm with the blanket. Okay. So hopefully you guys are seeing how this is coming together since I started talking to you with respiratory emergencies, cardiovascular emergencies, abdominal emergencies, talking about poisons. Okay. Immunologic, reactions. So, circulation, assess the skin, assess the pulse and skin color, temperature, and condition. Transport decision. Consider prompt transport for patients with obvious alterations in the airway, breathing, circulation, or for patients you have determined have a poor general impression. Everyone who is exposed to the hazardous material must be thoroughly decontaminated before leaving the scene. History taking. Investigate the chief complaint. Why am I here? What did you take? Why did you take it? How much did you take it? Where did you get it at? What's your weight? Have anything to eat or drink before this? Okay. If your patient is responsive, begin with an evaluation of the exposure and the sample, signs and symptoms, allergies, medications, passport and medical history, last oral intake, and events leading up to. If your patient is unresponsive, attempt to obtain the history from other sources: mom, dad, brother, sister, boyfriend, girlfriend, bystanders, co-workers. Does anybody know? Can anybody answer any of these questions? Ask the following questions. What is the substance involved? When was the patient exposed? What was the level of exposure? Has the patient or a bystander performed any interventions? How much does the patient weigh? Physical examinations. Now we're talking about the secondary assessment. Normally in the secondary assessment, you will concentrate on the affected body part or body system. Okay? And there's 8 body parts / systems. If you guys remember, if you don't, go back to your handout that we gave you of a patient assessment for medical or trauma. Okay, but those things are cardiovascular, pulmonary, neurological. It could be musculoskeletal. It could be your psychological or social, reproductive for male or female. It could be integumentary, and last but not least, it could be the GI. So those are the 8 symptoms, the 8 systems in the body that could be affected. 1 could be affected, 2, or they could all be affected. All depends. And that's what you need to determine when you are doing your secondary assessment. Okay? Focus on the general area of the body involved with the poisoning or the route of exposure. A general review of all body systems may help to identify systemic problems. Okay? So if the person's having a hard time breathing, do you think that the heart's affected? Most likely. Because if the person can't breathe, they're not diffusing that much, and that means that the heart's going to have to work harder to make up for the oxygen that it's not getting. So that means that the blood pressure is going to be higher, and the pulse will be higher. Or, worst case scenario, the opposite, the pulse could be low, and the blood pressure could be low because the body can't compensate anymore. So if the person's in shock, now they're in decompensated shock because the body just can't fight it anymore. Now the body's given up. 5 more minutes, nobody there, the patient will be dead. Okay? Get a complete set of baseline vital signs: blood pressure, pulse, respiration, BGL, equal bilateral chest movement when they're breathing. Do a neural check. Okay? Neural check fast, face, arm, speech, and time. It's not only good for determining whether you have a stroke, but it can also be determined to help determining if there's any systemic problems and what else is being affected. Okay? Reassess the adequacy of the ABCs. Reassess your work. Have you done any interventions? Are they working? Yes or no? If they're working, great. If they're not, then find something else that'll work. Repeat the vital signs. Compare them with the baseline vital set. You want to see, is the blood pressure going up or is it going down? Are the respirations improving or are they getting worse? Okay? Pulse, is it going up or down? If there's anything that's changing, that's called trending. Is the blood pressure getting higher and higher and higher? So if the blood pressure is trending upwards, are the respirations going slower and slower and slower? Respirations are trending downwards. Okay? Trending is when your vitals change. So you want to have a record. Doc, when we picked the patient up, the blood pressure was 120/80. It took us 25 minutes to get here. It took blood pressure 2 more times. The second time it was 132/90. The third time is 146/106 right now. So the blood pressure is trending upwards. That tells the doctor something. That can tell the doctor something. Okay? Reevaluate your interventions. Stable patient 15 minutes, unstable patient every 5 minutes. Or constantly for a patient who has consumed a harmful or lethal dose. I tell people in an ambulance, when you're teching the patient, you have 2 places you can sit. Either one, you can sit right behind the patient, what they call the airway seat, or 2, you can sit in the bench seat, right alongside the patient. I tell all my students, sit on the bench seat. There's no need for you to be sitting in the jump seat unless it's a severe case and ALS is on scene and you are breathing for the patient. Then you should be in the jump seat, or you should be in the airway seat, and there's other EMTs back there with you. But if you're the only one back in the back, you're taking the patient, you're en route to the hospital, you need to be seated to the left of that patient on the bench seat so you can keep an eye on them the entire time. Plus, it makes it much easier to do vitals if you're sitting alongside the patient instead of behind them. Communication and documentation. Report as much information as you can about the poison or chemical to the hospital and everything that took place. The condition of the location you were, what you smell, what you hear, see. Okay? Bring or have the company fax, the material data sheet to the hospital if the poison occurred at a work setting. So if it was an industrial accident and they have MSDS sheets, get the MSDS sheets from them. So you can provide that stuff to the hospital and they can take a look and they can figure out what the guy was poisoned with. Ensure scene safety. Follow standard precautions. Perform external decontamination. Remove tablets or fragments from the patient's mouth. Wash or brush the poison from the patient's skin. Assess and maintain the patient's ABCs. Treat for shock and transport the patient promptly to the nearest hospital. And some ES systems allow EMTs to give activated charcoal by mouth. Okay? In Rhode Island, you're allowed to. But depending on where you work, protocols might be different. Become familiar with the protocols in the area or the city or the state that you're working in. Okay? Activated charcoal binds to specific toxins, which are then carried out of the body by pooping. The time that you do not give activated charcoal is someone who has ingested an alkali poisoning, cyanide, ethanol, iron, lithium, methanol, mineral acids, or organic solvents. These things are just designed to destroy, and it's the chemicals are going to do more damage to the tissue as it goes through the body. Plus, activated charcoal won't work on them. You do not use this on somebody who has a decreased level of consciousness and cannot protect their airway. The reason being is that sometimes trying to get somebody to drink this stuff, it's so thick and disgusting that they'll actually vomit it up, or they'll vomit some of it up. If anybody ever vomits any of this, last thing you want to ever happen is for them to aspirate or inhale any of this stuff. This stuff is extremely thick and so sticky, and if it gets into the airway, then you've got an airway problem. You will likely carry plastic bottles of premixed suspension, each containing up to 50 grams of activated charcoal. Some of the names of activated charcoal are otherwise, it's also known as Instachar, Actidose, or Liquid Char. Okay, the usual dose on this is 1 gram for a child. The usual dose for an adult or child is 1 gram per kilogram of weight. So, if you have an adult who's 200 pounds, right, and you want to figure out what their gram is in what their weight is in grams, how do you do that? You guys remember how I told you how to do it? They weigh 200 pounds. Take the total weight, break it in half, right? So that knocks it down to 100. Then you take 10% off of that, which is 10. So you got 90 kilograms. So the usual dose for an adult or child is 1 gram per kilogram. So if someone's estimated kilogram weight is 90 kilograms, how many kilograms are you going to give them? It's going to be 90. Okay? It's going to be 90 kilograms. Or it's going to be 90 grams. Okay? You need to obtain approval from medical control, shake the bottle very vigorously, and record the time the charcoal was activated. Okay? The dosage and administration for an adult, you're going to give anywhere between 25 to 50 grams, and a pediatric, you're going to give anywhere between 1 to 2 grams. So it's basically the same thing. Okay? Special considerations for the medication: it must be stored in a closed container. You can't give them something that's already been opened. Once it's been opened, you got to throw it away. Whatever's not used, throw it away and get a new bottle. You got to make sure that you mix the contents very, very well prior to administration. Okay. And let's see. Some of the other times you're not going to give the medication would be, let's see, they have the altered mental status. They can't control their swallowing. If they ingested a corrosive or caustic or petroleum products, you can't give it to them because it's not going to do any good. And another one of the adverse reactions, if they do take some of it in, it's going to make them hard for them to poop because the stuff is really thick and black. If the patient refuses activated charcoal, document that refusal and transport the patient for further evaluation. Okay? Document whether they do or do not take the medication. Side effects: constipation and black stools. If the patient has ingested a poison that causes nausea, he or she may vomit after taking charcoal. That's very possible. Okay? That's a good thing because they get the poison out of their body, but it's a bad thing because as it comes up and out of the stomach, it could be, based on what it is, it could be doing additional damage. It did damage going down, now it's coming back up. It's going to do additional damage, plus it's going to be absorbed more because you absorb stuff through your throat anyways. Over time, a person may need increasing amounts of substance to achieve the same result. Remember that was? It's called tolerance. Okay? Safety awareness and standard precautions cannot be overemphasized. Known drug abusers have a fairly high incidence of serious and undiagnosed infections, including AIDS and hepatitis. Okay? Drug users, I cannot repeat this again. I'm going to, but I can't repeat it enough. People who are habitual drug abusers have a very high probability they have a very infectious disease, hepatitis and AIDS. Be very, very careful. If they're coughing, put a mask on them, and you cover them, and you put a mask on yourself as well. Okay, be very, very careful. Alcohol. Alcohol is a poison if it's taken too much. It can do damage to the liver, whether it's through chronic use or occasional heavy use, otherwise known as binge drinking. Binge use can be more damaging than chronic use. Chronic means it's being used over an extended period of time. Binge drinking is you go out every weekend and you get so hammered you don't remember and you go back to work on Monday. That's binge drinking. You do that over a period of time, you can create a lot of damage to your body. Alcohol is a very powerful central nervous system depressant. It decreases activity and excitement. It induces you to get tired and go to sleep. It dulls the senses of awareness, slows down your reflexes, and reduces reaction time. Okay? So you drive in the car and you're drunk. You see a red light. Oh, okay, I'll stop. You don't stop as quickly as you should. Someone cuts you off. You don't swerve as quick as you should. It may cause aggressive and inappropriate behavior and lack of coordination. So you've seen the two different types of drunks. Some people are drunk and they just get really laid back. Other people become drunk and they become jerks. They're known as the mean drunks. They want to start a fight. Okay? Alcohol increases the effects of other drugs and is commonly taken with other substances. If you're taking a prescription for something and it says don't drink alcohol with this, it's because it'll either intensify the effects of that medicine, which is not supposed to do, or the medicine will not be as effective as it's supposed to be. If a patient exhibits signs and symptoms of a serious central nervous system depression, you must provide respiratory support, which also may cause vomiting. Patients may experience frightening hallucinations or delirium tremors. Delirium tremors are characterized by agitation and restlessness, high fever, sweating and tremors, seizures, confusion, and delusion. Confusion is disorientation, delusion is hallucinations. Opioids. Okay? Opioids is a type of narcotic medication which is used to deal with pain. Okay? Let's see this here. Okay? Examples of opioids are codeine, heroin, morphine, fentanyl, oxycodone, hydrocodone. You guys have heard of all those: oxycodone, hydrocodone, codeine, heroin, fentanyl patches, and morphine. Those are all opioids. Opiates is a subset of the opioid family and is a natural, non-synthetic opioid. Okay? Opioids are man-made. Opioids are natural. Okay? A narcotic is narcotics produce a sleep and altered mental status. Opioids come from poppy seeds, which is where they make codeine and morphine from. Okay? Opioids are natural. Opioids are man-made. But when it comes to making, they use the poppy seed and they make codeine and morphine with that. Okay? Those are man-made, but they use the poppy seed to do that. Okay? You've got sedatives, hypnotic drugs. Okay? The hypnotic drugs are the sedatives, otherwise known as the date rape drug, roofies, or Special K. Okay? You've got abused inhalants, acetone, glue, like the model glue I told you about was in the first picture, spray paints, like I talked to you guys about. You got another one that's called hydrogen sulfide. Hydrogen sulfide is basically known as sewer gas. You go down to the sewers and it's disgusting gas. Well, it's poisonous. Okay. You also get hydrogen sulfide in swamps, and when volcanoes are erupting, or you're near a volcano, you get a really, really strong rotten egg smell. That's hydrogen sulfide. Okay. You got what they call simple pathomimetics. It's a stimulant, most commonly known as amphetamines or methamphetamines. Then you got your bath salts. Everybody knows about bath salts nowadays. They snort it up. You got marijuana, and we all know marijuana is slowly being legalized and stuff like that. You got hallucinogens. You've got I can never pronounce these two. Anti-cholinergic agents and cholinergic agents. And I know those will be in the book. I just got to find them. Let's see. Opioids. Opioid dependency can occur after taking a medical prescription. Opioids are central nervous system depressants and can cause severe respiratory distress. Tolerance to these does happen very quickly. An overdose can cause nausea and vomiting. If it knocks you out, it'll create hypotension. And people who are taking too many opioids will appear to be unconscious and cyanotic, and their pupils will be pinpoint, like little needles. There's a drug that we can give if somebody overdoses an opioid. It's called naloxone. Love this drug. Absolutely love it. I think it's the next best thing. Next to aspirin. Naloxone reverses the effects of opioid or opioid overdoses literally almost immediately. You're just about done, or you just finished injecting it into the person's arm and they're already waking up. and they could have literally been seconds away from death. This can be given through an IV, intramuscularly, which is right in the arm, right in the muscle, or intranasally, a nasal spray right into the nose. Okay. In many EMS systems, EMTs administer naloxone by the intranasal route. Yep. We stick up their nose, we spray it up, half the dose in one nostril, half the dose in the other nostril. Find out from bystanders if the patient was given naloxone prior to EMS arrival. Okay? You can give a maximum dose of this medication. Okay? Some towns are different, some municipalities are different, some employers are different, states and cities. You have to research what your state or what your what the protocols are, where you work. But as of right now, on a national level, the mechanism of action of this is that it's competitive inhibition at a narcotic receptor sites. So basically, the sites on the cells that allow the narcotic to latch onto, it blocks those. So the narcotic cannot be absorbed by the cell. Okay? When a person has overdosed on an opioid or an opioid, it's a central nervous system. It slows down their respiration almost to the point of not breathing. It reverses that effect right away. Okay? It could give you a rapid heartbeat. It could give you hypertension. It could put you in a cardiac arrest when we give the medication, but I've never heard that happening. It can create possible nausea and vomiting on a person. And the person's going to have immediate withdrawal symptoms, especially if the patient is addicted to the opioids. You know how people, when they go through withdrawal symptoms of alcoholism, is basically almost identical to drug rehab, a drug withdrawal. They can become very agitated, very violent. And that can happen in the back of the truck when you give them this medication, so be very, very careful. Okay? The adult dose on this, okay, is 2 milligrams intranasally every 3 to 5 minutes until you have restored adequate respirations. You can give a total of 10 milligrams. So it's a 2 milligram dose, and you can give that dose up to 5 times for a total of 10 milligrams. So when you squirt it up the nose, 1 milligram up one nostril, 1 milligram up the other nostril. And it comes in a dosage, pre-dosed container. Okay? For pediatric patients who are under 20 kilograms, you're going to give 0.1 milligrams, repeat every 3 to 5 minutes, for a maximum of 2 milligrams. Okay? Patients over 20 kilograms will be treated the same as adults. It's onset, so once you give the medication, it happens almost instantaneously, definitely within 2 minutes, and it's going to last in the system about 30 to 60 minutes, about a half an hour to an hour. And after that, if the drug is still in their system, they're going to go right back into how you found them. So a lot of times you might have to give them a second dose if you're with the patient for an extended period of time. You will have to most likely assist the ventilation with the patient. Be prepared for the seizures. Even though they may come out of it, it might not reverse the hypotension. It may not reverse the person's lack of response. So just be prepared for cardiac arrest. Barbiturates and benzodiazepines are easy to obtain and relatively cheap. They are central nervous system depressants, which can alter the level of consciousness. The patient may appear drowsy, peaceful, or intoxicated. These agents are generally taken by the mouth. Occasionally, the capsule are suspended or dissolved in water and or injected. IV sedative drugs quickly induce tolerance. These drugs may be given to people as a knockout drug. And your treatment is to ensure the airway is patent, which is secure, assist with ventilations if needed, and provide quick transport. Okay. Abused inhalants, I talked about that. Acetone, glue, spray paints. I talked about the hydrogen sulfides, simple PET the bath salts, marijuana, the hallucinogens. Okay. Anticholinergic agents. Medications that block the parasympathetic nerves. Otherwise described, the patient is hot as a hare, blind as a bat, dry as a bone, red as a beet, and mad as a hatter. These include atropine, Benadryl, Jimson weed, and amitriptyline. The patient can go from a normal to a seizure and death within 30 minutes. These cholinergic agents, not like the one before, the anti ones, but the actual agent itself, overstimulate normal body functions that are controlled by the parasympathetic nervous system. They include nerve gases designed for chemical warfare and organophosphate insecticides. These are really bad things. They're really, really bad. Okay, use the mnemonic dumbbells to remember the signs and symptoms of this type. DUMBELS, diarrhea, urination, mosis, bradycardia, bronchospasms, emesis, lacrimation, and seizures. Also, you can use sludgium, salivation, sweating, lacrimation, urination, defecation, gastric upset and cramps, emesis, and muscle twitching. You're rarely ever going to run into this kind of stuff. The most important consideration is to avoid exposure yourself. If you feel you're exposed, contact the hazmat team and they'll decontaminate you. An antidote kit may be available, otherwise known as a duodate auto-injector. The kit consists of a single auto-injector containing atropine and pyridoxamine. Okay, that is something that you give to yourself. You'd use that to take care of yourself in case it was a weapon of mass destruction and you were exposed to it. Okay? Some private ambulance companies used to carry them, but then they got cheap and they stopped carrying them for the EMTs. And they're not on the trucks for EMTs to use anymore because they're too cheap to put on them. Okay, miscellaneous drugs. You guys can take a look at this in your book, page 21-6. Miscellaneous drugs. Aspirin poison remains a potentially lethal condition. Ingestion too many aspirin may result in nausea, vomiting, hyperventilation, and ringing in the ears. Patients may have anxiety, confusion, tachypnea, hypothermia. Hyperthermia. We mean that they're too hot, or may be in danger of having massive seizures. Acetaminophen, okay, otherwise known as Tylenol, is also very common. It is to be treated promptly and aggressively. Food poisoning. Here we go. Food poisoning. Almost always caused by eating food contaminated with bacteria. Organisms itself may cause disease. Organisms may produce toxins that cause the disease. Salmonella bacterium causes salmonellosis, characterized by severe GI symptoms within 72 hours of ingestion, including nausea, vomiting, abdominal pain, and diarrhea. Proper cooking kills bacteria, and proper cleanliness in the kitchen prevents contamination of uncooked foods. Also, cross-contamination. You can't cook chicken. You can't have raw chicken on a cutting board, and then when you're done with it, use the same cutting board with all the chicken juice on it, and then put raw meat on it, and then process that. Or have seafood. You can't have beef, chicken, and seafood mix. You can't, under any circumstances. If you do, you have cross-contamination, you will kill somebody. Or somebody will get extremely, extremely sick because they're cross-contaminated. More common cause of food poisoning is the ingestion of powerful toxins produced by bacteria, often in leftovers. The bacterium Staphylococcus is quick to grow and produce food toxins in food. Foods left unrefrigerated are common vehicles or common ways of getting food poisoning. The most severe form of toxin ingestion is botulism. Can result in eating improperly canned food. Symptoms are neurologic, blurred vision, weakness, difficulty in speaking and breathing. So if you get a can of peaches and the can is bulging, there's botulism in that can. Don't open it. Don't eat it. Just throw it away. Okay? If your grandmother used to make homemade tomato sauce and you'd can it, and they'd go to get a can and the top is puffed out, they throw it away because it's not good. Try not to determine the specific cause of the acute GI problems. Gather as much history as possible from the patient. Transport promptly to the hospital. And when two or more persons have the same illness, take along the suspected food if at all possible so they can be examined at the hospital. Plant poisoning. Lots of plants out there. Okay? Mistletoe is poisonous. Tree tobacco is poisonous. So don't smoke. Castor beans, nightshade, lily of the valley, hemlock. Okay? Water hemlocks. A lot of different plants out there are poisonous, but they're very common, and we have them in our yards. Okay? We don't eat them. They look pretty. Mistletoe looks pretty. You get a kiss a girl with girls, you get a kiss a boy. Okay? But that's the only thing that the mistletoe is good for. It's poisonous to you, though. Don't eat it. Okay? If somebody has ingested it, assess the airway and the vital signs and notify the Poison Control Center. Take the plant to the emergency department with you so it can be evaluated. Okay? So that does it for this chapter. So let's do the review. Question number 1. Which of the following questions is of least pertinence? Or basically, which of the following question is not important for the EMT, or is the least important for the EMT to ask when a patient who intentionally overdosed on a medication? How much do you weigh? How much did you ingest? What substance did you take? Why did you take the medication? You want to ask them all eventually. But the one that the EMT is more concerned with is what? A, B, and C. D. Why the patient took it. Does that have anything to do with, let me go back to it. Let's go back to the first one. How much did you weigh? Or how much do you weigh? Is that important? Yes, it is. Why? Because that determines how much medicine we're going to give somebody. How much did you ingest? Is that important? Yes, because we need to know how much they took. What substance did you take? Why is that important? Because we need to determine, can we give the person something or not. And also tells the doctors whether they can or can't give them something. Why did you take the medication? That's more of a question for a psychologist to ask. Why did you take it? But you're probably going to have enough time if the person is patient and conscious. If the patient's conscious and alert talking to you. Ask them, why did you take it? So the answer is D. A 30-year-old male who ingested an unknown substance and begins to vomit, you should what? A, collect the vomitus and bring it to the hospital. B, apply BVM. C, analyze the vomitus and try to identify the poison. Or D, suction his oropharynx for no longer than 30 seconds. Well, when you suction somebody, even as an adult, it's what? No more than what? 15 seconds? It's going to be A. If the patient vomits, examine the contents for pill fragments. Ensure that you are wearing proper PPE and try to collect them and take to the hospital. Number 3. When caring for a patient with a surface contact poisoning, it is important to remember what? Prevent contamination of the patient, where they're already contaminated. B. Avoid contaminating yourself. That sounds like a good idea. Let the hospital remove the poison, let the hospital remove the poison from the surface. No, we're supposed to do that as much as we can. And D, immediately flush dry chemicals with water. No, we're not supposed to flush them. We're supposed to brush them off with a dry towel and then flush the area. So the answer would be what? B. Emergency care for a patient with a surface contact poison includes avoiding contaminating yourself and others and removing the irritating or corrosive substance from the patient as rapidly as possible. Dry chemicals must be brushed from the body prior to flushing with water. Most poisons occur via the what? Injection, ingestion, inhalation, or absorption. Which one is it? Most poisons occur, as they said earlier in the chapter, by mouth, ingestion. Approximately 80% of all poisons occur by ingestion, deliberate or non-deliberately. So they say injection, less than 20% of poisons occur by injection, and less than 20% of poisons occur by inhalation or absorption. Number 5. How much activated charcoal should you administer to a 55-pound child who swallowed a bottle of aspirin? How much activated charcoal should you administer to a 55-pound child who swallowed a bottle of aspirin? So let's see. Take the child's weight, 55 pounds, cut it in half. And that's what, 22 and a half? Okay. What's 22 and a half? Well, we don't deal with halves, so if you have a half, just round it up. Okay. 22 and a half, so knock that up to 22 and a half. That'd be 23. 23 kilograms, right? So take 10% off of 23 kilograms, which would be 2.3, which would leave you with what? Let me write this down. Let's see what I say. 22. Patient's 55 pounds. Half of that is 22, so that's 23. 10% is 2.3, rounded up to 3. So his weight would be 20 kilograms, right? So it's 1 gram per kilogram. So is it 50 grams? Is it D? No, because that's way too much. Would it be C, 2 kilograms per kilogram? Close to it. Okay, but that's not, it's asking you how much would you administer. Is it 25 or is it 12 and a half? The answer would actually be, I believe, 25, which would be, well, hold on. I'm sorry, I'm going the wrong direction. I believe the answer is B. Yep. The usual dose of activated charcoal for adults and children is 1 gram of charcoal per kilogram of body weight. To convert a patient's weight from pounds to kilograms, simply divide the weight in pounds by 2.2. Oh, I'm not going to confuse you guys with that. Okay? 6. After taking Vicodin for 2 years for chronic pain, a 40-year-old man finds that her usual dosage is no longer effective and goes to the doctor to request a higher dosage. This is an example of what? Addiction, dependence, tolerance, or drug abuse. Tolerance. They need to take more of it to get the same effect. And this is one thing that's hard for doctors to deal with because they want to give the medication for pain, but they don't want the person to become dependent on it. They don't want them to become addicted to it. So a lot of times doctors will say, no, I'm not going to increase the dose, and no, I'm not going to give you a refill on this pain medication. Number 7. Which of the following which of the following effects does drinking alcohol not produce? Induction to sleep, slowing of the reflexes, inappropriate behavior, or increased sense of awareness? Let's see. Someone who's drunk. Have you ever seen somebody who wants to go to sleep when they're drunk? I have. Is a person faster or slower when they're drunk? Usually slower. Inappropriate behavior. Do they act stupid? Want to start fights, yell, or argue with people? Usually. Sometimes. Increased sense of awareness? I don't think so. Drinking alcohol is both a sedative and hypnotic. Induces sleep. Number 8. A 20-year-old male was found unconscious in an alley. Your initial assessment reveals that his respirations are slow and shallow, and his pulse is slow and weak. Further assessment reveals that his pupils are bilaterally, which means they're both constricted. His presentation is most consistent with an overdose of what? Cocaine, an opioid, a stimulant drug, or a methamphetamine. It will be an opioid. Opioids are central nervous system depressant drugs, which, when taken in excess, they can cause respiratory depression, bradycardia, or hypotension. Another common sign is constricted, the moisis. That's when the eyes go pinpoint. Cocaine, stimulant drugs, uppers, and methamphetamines have the opposite effect. They stimulate the central nervous system and causes tachycardia and hypertension. That's when the person's like off the wall. They took a drug and they want to climb Mount Everest. They want to run a 5-mile run in 2 minutes. Okay? The mnemonic dumbbells can be used to recall the signs and symptoms of a cholinergic drug poisoning. The E in dumbbell stands for what? Oh yeah, emesis. Okay. Last one. Food poison is almost always caused by eating food that contains what? C, bacteria. Food poison is almost always caused by eating food that contains bacteria. Salmonella poisoning and botulism, two common forms of food poisoning, are both caused by bacteria. And that's it. Okay, everybody. Once again, you guys take care of yourselves. Please stay safe. Practice social distancing. You walk out of the house, please wear a mask or something over your mouth, especially if you go into the store or something like that. Even if you go to a gas station, see if you can wipe down the pump on the gas station. I know it sounds crazy and it sounds way overprotective, but that's what we need to do nowadays. So stay safe, everybody. Make sure you do all your work on JBL. Get that done. And I wish you all the best of luck, and I'll talk to you guys next time. See you later.